Have you ever gone to the doctor, explained exactly what's wrong, and just felt like they didn't really hear you? Like they nodded, maybe ran a quick test or two, and then they told you it was probably stress or anxiety or that you should just wait it out. Maybe it's something in your head. Because for a lot of women, that's not a one-time experience. It's kind of the pattern. And after a while, a lot of people stop going back. So instead, they start to figure out things on their own, whether they use Google, Reddit, herbal remedies, or things like Kratom, which has been blowing up in popularity within the last couple years, especially in Georgia. I don't think that people want to self-medicate. I think that they just feel like they don't have a better option. So let's talk medical bias. According to the CDC, nearly a quarter of American women live with chronic pain, which is a higher proportion than men. But despite that, women are less likely to receive adequate treatment and often not in a timely manner. And we see this reflected in research too. Harvard Health Publishing cited a study published in August of 2024 in PNAS that found that clinicians actually treat men and women differently when they show up at the hospital in pain. On average, women wait about 30 minutes longer to be seen and are less likely to receive pain medication for the exact same complaints. And it goes beyond just wait times or prescriptions. There's a much deeper historical pattern in how women's pain is perceived. Women have been labeled as hysterical, emotional, overly sensitive, weak, basically anything that would make their problems seem less real or less urgent. Basically, that it's psychosomatic. And that history isn't as far removed as we might think. Things such as lobotomies were used on women at disproportionately high rates compared to men. And if you look at all of that together, seeing why women might stop trusting doctors or going to them, it's not that surprising. Because if you're going to a doctor over and over again and keep feeling unheard or dismissed when you leave, eventually you're going to stop expecting help from that system. And that's where things start to shift into a little bit more dangerous territory. So, when people stop trusting traditional healthcare, they don't just do nothing. They look for alternatives. And that's where self-medication comes in. There was a study from the National Library of Medicine that looked at self-medication habits in college students, and what they found was actually really telling. Female students were significantly more likely than male students to self-medicate as their first form of treatment. The numbers were about 61.9% compared to men being about 38.1%. So, right there, we're already seeing a gender difference. And when you connect that back to what we've just talked about, women not being taken as seriously in medical settings, it starts to make sense. Because if your pain is dismissed or not treated properly, it takes longer to even be acknowledged. Of course, you're more likely to start handling things on your own. It's not random, it's a response to what's happening systemically. And another thing that I thought was interesting was the study also looked at income level and self-medication use. And they found out that about 69.6% of low-income students reported self-medicating, specifically in order to avoid doctor's visits. And that adds a whole other intersectional layer onto this because we're seeing how socioeconomic and different classes are going to be self-medicating at different levels. Because if you're not able to pay for a doctor's visit, then why would you take out that time in order to do that? So if going to the doctor is too expensive or time consuming or just not helpful based on past experiences, which is the case for a lot of women, self-medication starts to feel like the more practical option. So when you put all of this together, we're seeing this pattern where self-medication isn't a personal choice, but it's a response to larger systemic issues that we're seeing, particularly within the medical field. And I do want to be clear about something here. I don't think that there's anything wrong inherently with self-medication. Most people do it. If I have cramps, I'll take a Tylenol and I'll go about my day. That's normal. But there's a difference between the occasional low-risk self-medication and relying on substances that are much less regulated in order to manage your symptoms that you're experiencing. And that's where I'm going to start talking about something that we mentioned briefly before called Kratom. So you've probably seen it at gas stations, even if you haven't even noticed it, particularly within the area that I'm in. I know any gas station I go to, in the past couple months, have been noting when and where I see it, and it's all over the place. But it's become a lot more popular in the past years, particularly within Georgia, and it's often marketed by its marketing team as a natural solution for things such as pain or anxiety, but it's also used as an opioid withdrawal. And if you look up online, people talk and rave about how it's helped them so much. And especially, I feel like this is important for people who feel like nothing else has worked or they haven't been able to be taken seriously by the medical community. It shows that this substance by itself, and these people who would take it, they're not careless or impulsive. They're trying to solve an issue that hasn't really been solved for them. And I think that, kratom use is really existing in that kind of bubble that you have there. It's a kind of a gray area for me because it's not well regulated. It's not FDA approved as something clinically able to help you. And it also has a lot of addictive properties to it. It is an opioid, or it is an opiate. But since it's not well regulated within the states, and in Georgia, they recently made it so that you have to be 21 in order to get it, but it's still widely available to just grab at counters. Um, Outside of that, but I think that with it not being well regulated and it not having a lot of consistent long-term research, because it is very recently becoming popularized in the United States, I think that it can be improved the way that we have the system here. And I think that one person's experience might be that it helps them, but another person's might be different. And that's what I've also seen online is that for a lot of people, they find it addictive and harmful, especially if they're using it over long periods of time, or in increasingly higher dosages. And that's what brings us to a situation where people don't feel supported by doctors and they turn to something that they actually think might help, but it's also not safe. And that's worst case scenario because instead of having a reliable, supported care, which is what you should get through your doctor, people are left to figure it out on their own. I want to tie this into something a little bit more personal. I live in Georgia, and as I mentioned before, Georgia doesn't really have a ton of regulation on kratom. And because of that, we've already started to see some pretty real effects. I saw a website that had was talking to Patrick Filkins, who works with the Georgia Poison Control, and he reported that since 2021, there have been about 543 cases of kratom exposure called in. And even more concerning, he reported that that's been a 66% increase between just 2022 and 2025. So this isn't just hypothetical. It's already happening and it's growing. And when you take that and combine it with everything that we've talked about so far, we can start to see a bigger picture forming. Women experiencing medical bias at a higher rate compared to men, a long history of women not being taken seriously when it comes to pain, higher rates of self-medication, especially among women and lower income individuals. And now we're seeing also a rapid increase in the use of a substance that's not well regulated, isn't FDA approved or recommended. They recommend against using it, and it's now becoming more and more accessible. So the question is, how do we actually understand all of this together? And for me, what I'm doing is I'm looking at this through a feminist lens. So at its core, feminism is addressing inequality, especially gender inequality, but also the systems that are connected and centered around all of it. And that's where the idea of intersectionality comes in. Intersectionality basically is just helping us understand how different factors such as class, gender, income, race, how all of those things overlap and shape someone's personal experiences and how they're all different. So when we apply that here, we stop looking at this as just individual choices and we start seeing a structural issue because Yes, right now, statistically, kratom use is more visible and apparent in men, but the conditions that push people towards self-medication, such as being dismissed in healthcare settings or not having access to affordable healthcare, disproportionately affect women, especially women that are in lower socioeconomic groups. And I think that if you're already someone who's struggling to be taken care seriously by doctors and or like you're tired of repeated visits to have the same outcome, or you've had experiences where it just didn't help, then self-medication starts to make more sense. Not as a good option, but as an accessible one. And intersectionality also adds another layer on that too, because people in lower income areas, regardless of gender, are more likely to be exposed to unregulated substances like kratom. For example, like I said before, where I'm at, I've visited three, four different gas stations within the last couple weeks, and I've seen all of the different kratom options that they have there. And it's widely promoted as being something that's incredibly like going to help you make you feel better. And so instead of looking at this as people making risky or irresponsible decisions, I think that a feminist perspective asks us to take a deeper look at it and show us how healthcare, economics, regulation are these things that are shaping the choices that are there in the first place. And I think that shift in perspective is really what's important about this, because if this problem is structural, then the solution should be structural as well. And I'm proposing a praxis that has a couple components in order to address this. Since these are pretty big systemic issues, I don't feel like there's any real clean-cut solution for this. And I think that given the severity and the sensitivity that this requires a little bit of nuance. So I'm not entirely for banning all of kratom. I think it can help for people suffering from opioid withdrawal, from what I've seen, but I think that there needs to be stricter regulation set in place. And I'm going to propose the what I call the Informed Patient Project. And this has three main goals, which is going to be kratom education, policy reform, and medical reform. Little bit about each of these. So for kratom education, this is going to advocate for increased education on kratom, including its risks, addictive potential, and the lack of regulation that it has specifically within Georgia and a lot of other states. And this is going to be done, in my mind, through community-based campaigns and through social media. So social media posts talking about the addictive potential of this, or flyers that we have throughout GCSU or tabling. Next, for policy reform, I think that this should happen at a local and state level within Georgia. This would include stricter regulation in terms of kratom sales and clearer label requirements. I feel like having a label on it that says that this is not FDA approved and it has addictive potential is something that would be a little bit more helpful in order to get people to maybe think secondly about it before going in and buying it. And I think that the next thing I want to talk about is medical reform. And this is going to be more like medical education for healthcare providers, talking about medical bias that women face and discrimination that they face within the medical field, and just making them aware of it. Just because as healthcare professionals, you are trained to have an education. Everything you learn is through education. And so if you're educated on something that is systemically been happening, I think that that can lower the chance that this might happen in the future. And I think that this would be done throughout courses within medical school, or just notes that professors could often give the students that they're teaching. But I think that through combining all three of these ideas, that my praxis is aiming not only just to reduce harm and addiction with kratom use, but also to address and tackle the systemic issues that have allowed this to happen in the first place. And I think it shows how feminist theory can and should be used in order to provide meaningful change.